My name is Tolulope Oloyede and I'm from Nigeria. I got to participate in the course Policy in Genetics and Genomics organized by the Pan African PGS Education and Research Initiative. Throughout this course, I gained deeper insights into the multifaceted nature of influencing genetic policy, especially within the African context. The modules covered critical areas including advocacy strategies, policy development process, ethical considerations, and real world case studies, all of which have expanded my understanding of how scientific research, ethical frameworks, and stakeholder engagement intersect to shape effective policy. One of the key lessons that I learned is the vital importance of evidence based advocacy, using credible research and data to support policy arguments will not only support or will not only strengthen the persuasiveness of your advocacy, but to ensure that the policies that are made are sustainable and impactful. The emphasis on building coalitions and alliances resonated with me as a practical approach to amplifying voices, pooling resources, and creating unified messaging that can influence policymakers more effectively, especially in my line of work. Additionally, the modules on ethical considerations emphasize the need to balance innovation in genetic technologies with respect for privacy, ethical, and public concerns. These elements are essential to maintain public trust and social license for genetic research. Uh, the case studies in policy advocacy illustrated the power of clear communication, coalition building, and evidence based arguments in achieving legislative and regulatory success, such as protection against genetic discrimination and regulations on gene editing technologies. These real world examples enriched my appreciation for the practical challenges and strategies in advocacy. The key highlight for this course for me was actually the debate. I got to oppose the motion that should African governments penalize hospitals and clinics that fail to carry out genetic testing protocols for antimicrobial resistance stewardship programs. Preparing and defending this position made me understand the ethical and logistical challenges that may be facing the healthcare systems in Africa. I became more aware of how policies that may seem straightforward in principle can have unintended consequences when implemented without consideration of resource constraint, infrastructural capacity, and ethical issues. And it also influenced or reinforced rather the importance of approaching policy advocacy with nuance, empathy, and a commitment to balancing accountability with support. Moreover, my communication skills were sharpened as I was presenting complex ethical arguments. I'm so grateful to Dr. Wafa and her team for putting this together because I have learned that effective policy advocacy is not just about pushing for change, but doing so thoughtfully, ensuring that innovation benefits us all, respects our rights, and reflects the realities of African society. Thank you.